High cholesterol is a silent problem that can gradually damage your arteries without you realizing it. And today I want to explain how you can begin to control it in a practical and natural way thanks to a key food that we will discuss later. When you understand how your body works, you can make better decisions and protect your heart with greater clarity. I am Dr. Gabriel Mina, and I ask you to take a few minutes, sit calmly, and pay close attention, because when we understand the reasons behind things, we trust more and apply what we learn more effectively. This is evidence-based health education, explained in a simple and clear way. Welcome to my channel. Here we talk about comprehensive health, longevity, and natural, very easy habits that help you maintain physical, mental, and emotional balance. Take note and share this information with your family and friends to help them improve their health. We upload new videos every day, so subscribe and activate notifications so you don't miss any updates. Before we continue, if you find this content valuable, a simple gesture such as liking the video or sharing it helps this message reach more people who need it. Thank you sincerely for being here and for taking care of your health. Now, let's get into the topic. Cholesterol is not only an issue for older adults. There are also young people and even children who can have elevated cholesterol levels. That is why this information is so important. I want you to understand that not all cholesterol comes directly from what you eat, and this is where the key to everything begins. Let's go step by step. Blood cholesterol does not increase mainly because you eat eggs, meat, or dairy. The cholesterol that comes from food, known as dietary cholesterol, has very little impact on blood cholesterol. That is why I often hear patients say, "Doctor, I eat eggs every day and my cholesterol is normal." And that is true, because that is not the real problem. What truly raises cholesterol, especially LDL or bad cholesterol, is saturated fat. That fat is the raw material the body uses to produce more cholesterol than it needs. And here a fundamental organ comes into play, the liver. Even if you do not eat any cholesterol at all, your body will still produce it, because it needs cholesterol to build cell membranes and many hormones essential for life. That is a normal and necessary function of the liver. The problem appears when too much cholesterol is produced and it is not eliminated properly. The liver makes cholesterol, packages it into particles called lipoproteins, and sends it into the bloodstream. When we talk about LDL cholesterol, we are talking about that cholesterol circulating through the arteries. If this cholesterol becomes oxidized, meaning it turns sticky, it begins to adhere to the walls of the arteries. Over time, this oxidized cholesterol forms plaques that gradually narrow and inflame the arteries. If this process continues, it can end in a heart attack. And this is not something distant or rare. Recently, during a holiday, I learned that a young person, even younger than me, died suddenly from a heart attack. A heart attack does not give warnings. Sometimes it leaves severe consequences, and other times it offers no second chances. That is why it is so important to understand how to prevent cholesterol from sticking to the arteries. And here comes some good news. The body has a natural mechanism to clean up this cholesterol, but it needs support. The liver has special receptors, like little hands, whose job is to grab LDL cholesterol from the blood and bring it back to the liver. Once there, that cholesterol passes into the bile and then into the intestine, with the intention of being eliminated. Here is a key point that many people do not know. For cholesterol to truly leave the body, it needs something in the intestine to drag it out. And that something is fiber. Without fiber, the cholesterol that reaches the intestine is reabsorbed and returns to the bloodstream, making the problem worse. In other words, cholesterol completes a full cycle: blood, liver, bile, intestine. But if there is not enough fiber, the cycle starts again and cholesterol levels continue to rise. Many people ask me what happens if they no longer have a gallbladder. I want to reassure you, the body adapts. Over time, the bile duct widens and performs a similar function. The process of cholesterol elimination continues to work, as long as there is fiber in the diet. I have seen this many times in my practice. I remember a patient who had been struggling with high cholesterol for years, taking medications but without fully improving. When we adjusted his diet by reducing saturated fats and increasing fiber, his levels began to decrease steadily. He himself told me that no one had ever explained this to him so clearly before. And here comes another fundamental point. Saturated fats not only raise cholesterol, they also do something very harmful. They reduce those liver receptors that help remove cholesterol from the blood. In other words, the more saturated fat you consume, the fewer hands your liver has to clean your arteries. Saturated fats are found in products such as butter, lard, processed meats, heavy cream, margarine, and also in some vegetable fats like coconut oil or coconut fat. It is not about eliminating them completely, but about reducing them consciously. You can eat fiber-rich foods, but if at the same time you continue consuming a lot of saturated fat, the effect will be limited. It is like sweeping the floor while you keep throwing trash on it. The food we will talk about today works on two fronts. It helps drag cholesterol out in the intestine and helps prevent that cholesterol from returning to the bloodstream. But for it to work properly, reducing saturated fats is essential. Before we continue, if this information is helpful to you, I invite you to subscribe to the channel and activate notifications. That way you will receive every new video with practical advice to take care of your health. Also, share it with someone you know who is dealing with high cholesterol. Many times we help more than we imagine. On this channel, Dr. Gabriel Mina is committed to explaining health in a clear, approachable way that you can apply to your daily life. In the next segment, we will go deeper so you can better understand how to support your body and give it the tools it needs to keep cholesterol under control. The problem many people face is that cholesterol remains high despite taking care of themselves. And today you will understand how to avoid serious complications and which practical decisions truly help. If you have gallstones that have already caused pain, it is normal to feel confused and afraid because you do not know what to eat or what to do. I will explain it clearly and without beating around the bush. Many people ask me why gallstones appear and whether there is something that can dissolve them or make them disappear. The honest answer is this. When stones are small but have already caused colic, pain, or attacks, the best option is usually to remove the gallbladder. There are no foods, juices, or remedies that melt them away. If something like that existed, I would tell you myself. When surgery is indicated, it must be taken seriously. The real risk with gallstones is that one of those small stones leaves the gallbladder and travels down the bile duct. That duct connects to the pancreas, and if a stone blocks that exit, it can trigger severe pancreatitis. That means intensive care, risk of death, and in some cases long-term consequences such as diabetes. That is why I always insist it is better to have scheduled surgery when the person is stable, rather than waiting for an emergency. Now let's return to cholesterol, because many people are told to take statins for life and do not always understand why. Statins work by blocking cholesterol production in the liver and reducing the amount that enters the bloodstream. The food we are talking about today does not work that way. It works differently. It prevents fat from becoming sticky in the arteries and helps sweep cholesterol out of the body. The liver can continue producing the cholesterol it needs, but in a balanced way. Scientific evidence is clear. When you reduce saturated fat intake, the liver begins to produce more LDL receptors, which are like small hands responsible for removing bad cholesterol from the blood. Less saturated fat means more receptors and greater artery cleansing. You may take medications, but if you continue eating a lot of saturated fat, cholesterol will not drop the way you expect. First practical tip: reduce saturated fat. I know it tastes good, but it needs to be reduced. You can use healthy fats such as those from avocado, peanuts, walnuts, or almonds without any problem. What truly matters is cutting back on butter, lard, processed meats, and saturated fats from both animal and plant sources. I want to be very clear with you. I, Dr. Gabriel Mina, do not sell miracle pills or supplements. I do not do that. My job is to give you clear and useful information so you can make better decisions. Sometimes we will talk about medications when they are truly necessary, but here you will not find false promises or sales disguised as advice. I have seen many patients improve once they understand this. I remember a man in his early 60s who had been taking statins for years without major changes. When he reduced saturated fats and adjusted his diet, his levels began to improve steadily. He himself told me that no one had ever explained it to him this way before. Now let's move on to the second key point. Increasing the consumption of fruits and vegetables reduces the risk of cardiovascular disease because they reduce the oxidation of LDL cholesterol. When cholesterol oxidizes, it becomes sticky and adheres to the arteries. The more fruits and vegetables you consume, the less likely that cholesterol is to stick and cause damage. This is where today's main food comes into play: kale, also known as curly kale or black kale. This food contains a large amount of antioxidants. It helps increase liver receptors and also acts in the intestine like a true broom, dragging cholesterol out so it can be eliminated in the stool. Evidence shows that kale has a protective effect against cholesterol oxidation, even in small amounts. A kale smoothie already has an impact, but ideally it should be consumed with its fiber to enhance the effect. Many people ask whether it helps with biliary sludge. Yes, it does, because it supports fat elimination. Others worry about thick blood. To make it simple, kale contains very little iron compared to meats and organ meats, and it does not cause that problem. It even improves iron absorption when combined with something acidic, such as lemon. Kale also contains more calcium than milk, and it is better absorbed. In people with hypothyroidism, there is no problem as long as medication is taken first and the recommended waiting time is respected before eating it. The way you prepare kale is important. Ideally, it should be blanched just like broccoli. That means placing it in boiling water for about 30 seconds and then transferring it to ice water. This process allows antioxidants to come to the surface of the leaf and makes the color turn a deep, intense green. That is when it provides the greatest benefits. When kale is properly prepared, it is easier to chew, more pleasant to eat, and much more effective at preventing cholesterol from sticking to the arteries. If eating it raw causes bloating or discomfort, this preparation method is a better option. In summary, for those who are just joining, the liver produces cholesterol, sends it into the bloodstream as LDL, and then tries to remove it using receptors. That cholesterol passes into bile, reaches the intestine, and if it encounters fiber such as that found in kale, it is eliminated. If there is no fiber, it is reabsorbed and returns to the original problem. Kale fulfills two key functions. It prevents cholesterol from oxidizing and sticking, and it helps remove it from the body. All of this works much better if you reduce saturated fats. It is not about strict prohibitions, but about smart and consistent decisions. You can consume kale every day, in salads, smoothies, as a replacement for lettuce, or even dehydrated occasionally. There is no strict amount. Listen to your body and make it part of your routine. We continue moving forward step by step with clear and practical information, because understanding what happens in your body gives you the power to take better care of yourself. The problem many people face is that even though they want to lower cholesterol and take care of their heart, they do not know how to properly prepare foods so they actually work. And here is a key part of the solution. When you see kale properly prepared, you immediately notice the color and texture. When blanched, it becomes softer, easier to chew, and much more pleasant. Raw, on the other hand, it is often tough and harsh. That is why I insist that to truly benefit from its properties, it is best to prepare it this way. Yes, how you cook it matters. Blanching makes a difference. As for oils, my recommendation is to use them cold whenever possible. If you need to cook or sauté something, olive oil is the best option because it tolerates heat better. At first, its flavor may take some getting used to, but over time it becomes enjoyable and your body appreciates it. Kale belongs to the same family as lettuce, but it is not the same. They are related, yes, but kale has much more powerful nutritional properties. That is why we are highlighting it today. Other vegetables from this family that also help are broccoli, cauliflower, chard, and spinach. All of them can be blanched, always for a short time, about 30 seconds, because if they are overcooked, they lose flavor, texture, and that intense green color that indicates nutritional richness. I have seen how these changes work in clinical practice. I remember a very disciplined patient around 65 years old who had been worried about her cholesterol for a long time. By incorporating kale almost daily, reducing saturated fats, and adding oats to her breakfast, her lab results began to improve within a couple of months. It was not magic, it was consistency and understanding the process. You can consume about 1 to 1.5 cups of kale per day without any problem. If you combine it with lower saturated fat intake and foods such as oats prepared the night before, the effect is much greater. For those with irritable or inflamed colon, kale also helps, because its fiber feeds the microbiota and reduces intestinal inflammation. Lard, coconut oil, and cocoa butter, even though some are of plant origin, are saturated fats. The problem is not the cholesterol they contain, but the fact that these fats are solid at room temperature, which reduces the liver's ability to remove cholesterol from the blood. That is why cholesterol levels rise. In cases of gallbladder polyps, kale can be consumed. If there are gallstones, it does not dissolve them, but it is not contraindicated. Kefir is a better option than industrial yogurt, although remember that all dairy products contain natural sugars. Kale juice does help, yes, but I always emphasize that fiber is key. That fiber is the broom that sweeps cholesterol out of the body. Even people with diverticula can consume kale without any problem. In fact, it helps colon health. The so-called side effects are positive. It lowers cholesterol, improves bowel movements, provides calcium that is better absorbed than that from milk, and provides iron, especially when combined with lemon. It is not a medication, it is a food. You can drink green smoothies with kale every day, but remember something fundamental. If you do not reduce saturated fat, all this effort loses strength. Without lowering saturated fat, the mechanism is incomplete and kale cannot do its job as it should. Now I want to invite you to pause for a moment. Just as we take care of the body, it is also important to care for the heart from within, the emotional and spiritual heart. Today I invite you, in a simple and meaningful way, to thank God for your life, for every day you breathe, and for the opportunity to learn new things that allow you to take care of your health and the health of those you love. Gratitude opens the heart and reminds us that we are not alone on this path. If this content is helping you, I warmly invite you to subscribe to the channel, share this video with someone you know is struggling with cholesterol, leave a comment, and activate notifications. Every day we upload new videos designed especially to support you, guide you, and take care of you. On Dr. Gabriel Mina's channel, we are very happy to contribute to your well-being, help you improve habits, and walk with you toward a healthier and more conscious life. Tomorrow there will be a new video, and we already look forward to welcoming you. Here, your health matters, your time matters, and your life matters. Thank you for being here, thank you for trusting us, and may God bless you always.